Oceanside Podcast is sponsored by Tri-City Medical Center. Tri-City's Coastal Initiative stands for community outreach and support through active leadership. The goal of the Coastal Initiative is to move the needle on community health issues and address social determinants of health. Tri-City Medical Center is more than just a hospital. It has one of the most technologically advanced emergency departments in North County, San Diego, and is nationally renowned for heart and stroke care. With over 50 medical specialties, board-certified emergency medical physicians, and state-of-the-art technology, Tri-City is your resource for quality care close to home. Learn more at tricitymed.org/community. Advancing Oceanside Podcast. I'm your host, Scott Ashton, and today we're very excited to hear about the North Coastal Prevention Coalition. So we have with us Aaron Byzak, the president of the organization, and John Byrom, the prevention specialist with Vista Community Clinic. How are you today, guys?
Doing good.
Doing well. Thanks, Scott.
Good. Well, great to have you both with us and share a little bit about the great work that you're doing. So, Aaron, we're going to start with a question with you. So many people know you through your work with Tri-City Medical Center, as well as involvement in local boards and affiliations. Tell us a little bit about North Coastal Prevention Coalition and about your role with the group.
Yeah, I got involved with North Coastal Prevention Coalition back in 2003, believe it or not. I was working for then Senator Bill Morrow, who represented North County, and I went to NCPC's 10-year anniversary party with him. And when I got there, I said, wow, this is an organization I can get behind. NCPC's mission is to reduce the harm of alcohol, tobacco, marijuana, and other drugs in the cities of Carlsbad, Oceanside, and Vista. And it does that through community action, education, support, and collaboration. And so when I heard that mission, I saw the work they were doing, it really struck a chord with me, because I come from a family of pretty severe drug and alcohol addiction with my parents. And I made a decision when I was very young, 11 years old, to permanently, forever stay away from drugs and alcohol. And so I saw NCPC working with at-risk kids like myself, trying to get them to make the same decisions and to influence decisions at the political level and the policy level to really create an environment in which kids can make that decision. So I saw that and I said, boy, this is the kind of group I should be involved with. And I've been there for now 17 years, going on 18 years. And I've been president of the board for, I think it's about 8 of those 18 years. And I'm president right now.
Great. Well, thank you for the volunteer work that you're doing there and elsewhere in the community. It's very valuable. So John, recently we featured 2 amazing members of the Youth Coalition from Oceanside High School who shared a little bit about their concerns with marijuana vaping and underage drinking. But today we're going to discuss a little bit more about the growing concern in San Diego County with opioids. Can you give us a little background on that?
Yeah, North Coastal Prevention Coalition, we work on 4 issues: underage drinking, methamphetamine, marijuana, and RX, medications. We just had the National Prescription Drug Take Back Day, and thanks to you put out our flyer. We gathered 741 pounds at Tri-City Medical Center.
Wow.
We had 193 cars come through and 46 boxes of medications. It was a huge success. And thanks to you and other organizations that put out our flyer for the event, it was really a success. We work on those 4 issues, but one that we're seeing and we're very, very afraid of these days is what we're seeing is fentanyl in our community. And according to the medical examiner, our number of deaths have gone up dramatically from last year to this year. You can see on this graph that we're almost to 300 deaths from fentanyl. It's a scary, scary drug. Back in my day, when they used to tell us, you don't know what's in those drugs, we kind of laughed at them. But that's what's happening today. What they're doing is putting fentanyl in pills that look like prescription drugs. The individuals think that they're taking like an OxyContin, but they're actually taking fentanyl, and these pills are killing people all over San Diego County. It's really scary in these days. So one of the things that we would like individuals is not to take anything from the street. No matter if you're buying it from somebody, don't trust that these are from a pharmacy. You have no way of knowing. And naloxone, you should be able to get a prescription for naloxone, which will reverse the opioid itself, and never use alone. Because of a lot of times individuals would have a naloxone there that could reverse the opioid, but they don't have time to take it. So someone else needs to be there. It's really a scary time, and they're putting this drug in all kinds of different drugs. So we want to get that out to individuals. It's really a scary time.
Yes, we had a presentation last week at our Emerging Issues Forum with the district attorney, Summer Steffen, and she really drilled home the point of the importance of this issue and what it means to our community. So, just along those lines, Aaron, from your perspective, what does this mean to us here in North County?
Yeah, when we look at the data from the Tri-City area, which is Carlsbad, Oceanside, and Vista, which is really the area that NCPC covers, and the area that I cover at Tri-City Medical Center, I'm the chief of external affairs there, as you know, we look at the data, and what we're seeing is that the highest risk category is Caucasian males. They have the highest overdose rates. We saw a shift in 2018, 2019 to a somewhat younger age demographic as having the highest overdose potential. It used to be kind of 60 and over. And that kind of makes sense, like accidental overdoses, because people of that age take more medications and things like that. But now it's shifted to the 20 to 29-year-old, which is, illicit drug use at that point. We were also from 2011 to 2017, we're averaging between 40 and 50 overdose deaths a year due to prescription drugs and fentanyl and whatnot. And that jumped in 2018 up to 62. So it took a big jump, and then it dropped back down in 2019 to about 42. But you could see this trend, this continuous trend of high rates of overdoses in our area. It's one of the reasons why Tri-City has been so very actively involved with NCPC. We look at things, we base all of our community outreach activities on public health risks and social determinants of health. All of our data comes from the Hospital Association, does a community health needs assessment. It identified alcohol, drugs, prescription drugs as priority issues in our community and throughout San Diego County. And so that's why we're heavily involved with NCPC and trying to reverse trends like this.
And one of the things that the county data showed was that there was 15 deaths for youngsters 17 and under, which is really scary. We didn't see that in the past. And what they're thinking is they're taking some other drug that not an opiate and ending up dying. We've even seen it in cocaine.
Right.
Yeah. So, John, obviously this is a very complex problem. What are some of the key points that you think that we should understand and be aware of?
Stigma is still a great problem. You would think after all these years that we would be over it and that treatment would be something that would be accepted, just like if you have diabetes, that you're treated for that diabetes. But we still see a lot of stigma when it comes to substance abuse treatment. And, it's a chronic brain disease characteristic by drug seeking and a compulsion to use drugs. So it's a disease just like any other. And what we want to do is reduce that stigma. We don't want call people addicts. They want to change the words to, because words matter. We don't want to keep somebody from entering treatment just by calling them something. I used to take intake calls at a treatment center, and one of the things that I always did was I didn't say to them, well, you're an addict, you got to do this. We talked about the problems that they're having, and even though they're having problems, they're still using, and we want to get past that. We want to get people into treatment. And one of the things in San Diego County that we're doing now is medically assisted treatment. My thoughts in the past were different, that, I don't think, you should use a drug to get off of a drug. But it's so scary that this drug is killing so many people that we need to have this treatment. And it reduces individuals' the pain that they go through when they withdraw, and they're able to start beginning their life, beginning in treatment too, and understand what's going on. They spend longer times in treatment, and that's what we want. We want to get folks into treatment. We don't want to push them away with stigma or other issues like that. People
I think the key
recover.
is that we're taking it from two different positions here. We want to prevent it from ever happening and getting as many people to make the positive life choice to stay away from drugs and never go down that road. But then if you have done that, to get you into medically assisted treatment as quickly as possible. And to John's point, some of the modern medications they have for that, they reduce the pain associated with going through withdrawals and stuff like that. And so it makes you more likely to actually go to treatment.
And stay longer.
And stay longer.
And that's what we want to get to. We want to stop young people from getting started. And if someone did start, to end it and get treatment. I've had support by my family from the very beginning, and I was lucky. I celebrated 34 years in recovery, and what's funny is that there's other people in my family that followed me in. We now have 12 people in recovery.
Nice.
And they didn't hit the bottom like I did, but they saw through me in recovery that their lives could get better too. And they followed me, and it's been really nice. I mean, we have a fun time when we get together, and we don't have to have those drugs or alcohol.
Yeah, that's great. That's great to hear, and it's great to hear what an example you've been to your family and the community. And I really like the multi-pronged approach of really focusing, on keeping the young people away from this in the first place, but having a plan for those that do get wrapped up in it. So, Aaron, tell us a little bit how people can get more information, how they can support your efforts, get engaged in this important community issue.
Yeah, there's a lot of opportunity now. We started the Prescription Drug Abuse Task Force in 2008, so it's been really running for about 11 or 12 years now. And they have a great website that you can go to learn more about that. It's San Diego RxAbuseTaskForce.org. A little long, but San Diego RxAbuseTaskForce.org. And so you can find out great information there. You can also go to our website for North Coastal Prevention Coalition, which is northcoastalpreventioncoalition.org. And there's all kinds of resources for parents and community members and case studies and things like that there. And you can also call 211 if you're looking for treatment and looking for assistance. So 211 San Diego is a great way to do it. Just pick up the phone, dial 211, and you'll get some resources.
And San
Great.
Diego County has one of the best treatment providers anywhere that I've known. And the whole system is really a wonderful system. I've never seen any other in any communities across the country that are any better.
San Diego is a great location for prevention and for treatment. A lot of cooperation between the various providers. And, you know, the amazing thing is, even though you see the numbers kind of going up over time, those numbers would be way, way worse if the prevention folks and the treatment folks weren't doing the great work that they're doing. And so, you know, we're hoping to start a downward trend on these things. You know, in 2008, when we launched the Prescription Drug Abuse Task Force, there was a lot of people telling us that there was no prescription drug abuse issue. And we're like, nah, actually there is. There's a big issue. And so we were on kind of the leading edge of that in California and in the United States, really. And so, you know, think about it, it took, what, 10 years for the federal government to recognize it as a problem?
Yeah.
And declare it a public health emergency. And so, you know, we're really fortunate to live where we are. And if you're a parent out there or you're a community member, there's lots of resources for you. Feel free to give us a call. You can even call us. I mean, you can find our numbers and our cell phone numbers. We're more than willing to talk to anybody who's out there.
And I have a long history in the treatment field, and I can help with getting individuals into treatment. So I'm always, you know, I do that for a lot of folks, and it something I enjoy. Also, I want to give a little thanks to Aaron, because back in 2008, I got a call from the DEA saying, John, you got to get involved in preventing this. We have a big problem. And so I called Aaron, and he started that task force, and that it's nationally known now. So
Great.
he even got Emmys for
We did win a few Emmys for the commercials we made. Yes.
Good.
I didn't even know that was possible in those days, but yes, it's possible.
Well, gentlemen, thank you for the work that you're doing, you know, especially for our youth, and just bringing this issue to the forefront in our community and keeping the focus on it. So just thank you for taking time to share your work with us today, and we look forward to sharing this with our audience. Thanks, guys.
Thank you.